Hello friends, Happy New Year to all of you. In this video, we are going to introduce you to the medical college and first year of MBBS. As you are watching this video, it means that you have completed the NEET exam and now you are up to start the MBBS journey. First of all, hearty congratulations to all of you to achieve these great marks and to achieve a seat in medical college. In medical college, what are the subjects that you are going to study? How should you study? And all like this. So, I am here to help you somewhat about it. So, first of all, your college timing would be around 8 to 4 or 9 to 5. In my college it is around 9 to 5. So in 9 to 1 you are going to have theory lectures. There will be 4 lectures each of 1 hour, and 1 to 2 you will be having a lunch break, and 2 to 5 there will be practicals. Now, what are the subjects that you have to study in the first year of MBBS? So there will be 3 subjects to be studied in first year. They are anatomy, physiology and biochemistry. First of all, anatomy is all about your body. Here you are going to study about bones, muscles, where it gets originated, where it gets inserted, what are the nerves supplying it, what are the arteries, veins, lymphatics and all that. All the internal organs like heart, brain, kidney, liver will be studied in cadaver in dissection. Talking about physiology, you are going to understand all the systems like how the respiratory system works, how our circulatory system works, how nervous system, digestive system works. Physiology is all about the functioning, rather normal functioning of our body systems. Biochemistry suggests that the living chemistry of a living being. Here you are going to study about carbohydrates, such as what is the function of carbohydrate in our body, how is it digested, absorbed, same way lipids, proteins, nucleic acids, xenobiotics and many other things. I will be providing further information about each subject in separate video. So now, talking about attendance, you must have 75% of your attendance. Friends, do not take tension. If you are regular, you will be having more than 75% of attendance very easily. Now, what are the new things? According to competency-based medical education, now you will be having early clinical exposure. As the name suggests, you will be exposed to clinical condition. For example, when you are taught anemia, you will be introduced to anemic patient so that you can look at the symptoms, signs and you can observe these things. Then you may get in early clinical exposure that how this X-ray is taken, how the sonography is done. It will be a very good experience to all of you. Now, on the Saturday, there will be going to be having half day. So at weekends, you will get a good time to study, to get relaxed. So it will be very useful. Only 9 to 1 for Saturday. Now, on how the subjects will be studied. On Tuesday, Thursday and Saturday, there will be anatomy only. So for 9 to 1, there will be 4 lectures of anatomy. So there will be gross anatomy lectures, then there can be histology lecture, and in practical, you will go for the dissection of what you have learnt and the histology. Yes, I want to tell you one thing. You will be taught a theory all together. That means how many students may be there, 100, 150, 200, all will be taught same together in the same room at the same time in theory class. Whereas you may get divided while doing practicals. Now, on Monday, Wednesday, and Friday, there will be the lectures of physiology and biochemistry. Theory will be together, means some lectures of physiology and some lectures of biochemistry. Then, for practicals, you will be divided in various batches. Some batch will go for clinical, some will go for HIMET, some will go for biochem lab. Now, let me introduce some of the things about practicals. In physiology, most probably 2 or 3 types of lab will be there. Clinical lab, HIMET lab, and one another lab. In clinical lab, you will be studying means general examination, how to take general examination of patient, how to take a systemic examination. In general examination, investigation, palpation, percussion, auscultation, everything will be done in a good manner. Now, what is hematology practical? It's all about your blood. Means you will be counting your RBC count, your blood group, WBC count, differential WBC count, and many other things. Hemoglobin count. Now, talking about biochemistry practicals, there will be major type of practicals, qualitative and quantitative. In qualitative, any sample will be given to you and you have to test whether it is carbohydrate, lipid, protein, and what is the type in carbohydrate. If it is carbohydrate, what is it? In case of quantitative, you know that the sample is this one, whether it is. If it is cholesterol, what is its concentration? If it is glucose, what is its concentration? That you are going to be calculating in quantitative test. Now, one thing that you should be take in your mind, that when you are in practical lab, you must be wearing your lab coat, then you must have your name badge, then you must be with your journal. These things are to be kept in mind. So friends, yes, medical study is somewhat different, it is somewhat difficult, it is a vast subject. But if you are going to do it with proper planning, then you will going to have a good time, you will enjoy your college life, you will get a good knowledge, and you will become a very good healthcare provider. I think this introduction would have helped you in such certain manner. If you find it useful, please press the like button my channel, and if you want any kind of video from my side, do let me know for that. Thank you.